Therapy, Wikipedia audio. Therapy is the attempted remediation of a health problem, usually following a diagnosis. In the medical field, it is usually synonymous with treatment. Among psychologists and other mental health professionals, including psychiatrists, psychiatric nurse practitioners, counselors, and clinical social workers, the term may refer specifically to psychotherapy. The English word therapy comes via Latin therapa from Greek, theta epsilon rho alpha pi epsilon alpha, and literally means curing or healing. As a rule, each therapy has indications and contraindications. The words care, therapy, treatment, and intervention overlap in a semantic field, and thus they can be synonymous depending on context. Moving rightward through that order, the connotative level of holism decreases and the level of specificity increases. Thus, in healthcare contexts, the word care tends to imply a broad idea of everything done to protect or improve someone's health, although it sometimes implies a narrower idea. In contrast, the word intervention tends to be specific and concrete, and thus the word is often countable. For example, one instance of cardiac catheterization is one intervention performed, and coronary care can require a series of interventions. At the extreme, the piling on of such countable interventions amounts to interventionism, a flawed model of care lacking holistic circumspection, merely treating discrete problems rather than maintaining health. Therapy and treatment, in the middle of the semantic field, can connote either the holism of care or the discreteness of intervention, with context conveying the intent in each use. Accordingly, they can be used in both non-count and count senses. Semantic field. The words asiology and iamatology are obscure and obsolete synonyms referring to the study of therapies. Levels of care classify healthcare into categories of chronology, priority, or intensity, as follows. Emergency care handles medical emergencies and is a first point of contact or intake for less serious problems, which can be referred to other levels of care as appropriate. Intensive care, also called critical care, is care for extremely ill or injured patients. It thus requires high resource intensity, knowledge, and skill, as well as quick decision-making. Ambulatory care is care provided on an outpatient basis. Typically, patients can walk into and out of the clinic under their own power, usually on the same day. Home care is care at home, including care from providers making house calls, care from caregivers such as family members, and patient self-care. Primary care is meant to be the main kind of care in general, and ideally a medical home that unifies care across referred providers. Secondary care is care provided by medical specialists and other health professionals who generally do not have first contact with patients, for example, cardiologists, urologists, and dermatologists. A patient reaches secondary care as a next step from primary care, typically by provider referral, although sometimes by patient self-initiative. Tertiary care is specialized consultative care, usually for inpatients and on referral from a primary or secondary health professional, in a facility that has personnel and facilities for advanced medical investigation and treatment, such as a tertiary referral hospital. Follow-up care is additional care during or after convalescence. Aftercare is generally synonymous with follow-up care. End-of-life care is care near the end of one's life. It often includes the following. Palliative care is supportive care, most especially near the end of life. Hospice care is palliative care very near the end of life when cure is very unlikely. Its main goal is comfort, both physical and mental. Treatment decisions often follow formal or informal algorithmic guidelines. Treatment options can often be ranked or prioritized into lines of therapy: first-line therapy, second-line therapy, third-line therapy, and so on. First-line therapy is the first therapy that will be tried. Its priority over other options is usually either formally recommended on the basis of clinical trial evidence for its best available combination of efficacy, safety, and tolerability, or chosen based on the clinical experience of the physician. If a first-line therapy either fails to resolve the issue or produces intolerable side effects, additional therapies may be substituted or added to the treatment regimen, followed by third-line therapies, and so on. An example of a context in which the formalization of treatment algorithms and the ranking of lines of therapy is very extensive is chemotherapy regimens. Because of the great difficulty in successfully treating some forms of cancer, one line after another may be tried. In oncology, the count of therapy lines may reach 10 or even 20. Often multiple therapies may be tried simultaneously. Thus, combination chemotherapy is also called polychemotherapy, whereas chemotherapy with one agent at a time is called single-agent therapy or monotherapy. Adjuvant therapy is therapy given in addition to the primary, main, or initial treatment, but simultaneously. Neoadjuvant therapy is therapy that is begun before the main therapy. Thus, one can consider surgical excision of a tumor as the first-line therapy for a certain type and stage of cancer, even though radiotherapy is used before it. The radiotherapy is neoadjuvant. Premedication is conceptually not far from this, but the words are not interchangeable. Cytotoxic drugs to put a tumor on the ropes before surgery delivers the knockout punch are called neoadjuvant chemotherapy, not premedication, whereas things like anesthetics or prophylactic antibiotics before dental surgery are called premedication. Step therapy or stepladder therapy is a specific type of prioritization by lines of therapy. It is controversial in American healthcare because, unlike conventional decision-making about what constitutes first-line, second-line, and third-line therapy, which in the U.S. reflects safety and efficacy first and cost only according to the patient's wishes, step therapy attempts to mix cost containment by someone other than the patient into the algorithm. Therapy freedom and the negotiation between individual and group rights are involved. Treatments can be classified according to the method of treatment. Types of therapies: by chronology, priority, or intensity. Levels of care. Lines of therapy. By intent. By therapy composition. By matter. By energy. By human interaction. By animal interaction. By meditation. By reading. By creativity. By sleeping and waking.